Richard Pizzi, editor of Healthcare Finance News and contributing editor to Healthcare IT News. Recently attended the RAC Summit in Washington, Recovery Audit Contractors, and I'd like to talk about what you learned at the summit, but also if you could start by giving us a summary of the status of this program.
Yes, the RAC program, the Recovery Audit Contractor Program, was established by the Centers for Medicare and Medicaid Services to guard the Medicare Trust Fund, to recover overpayments and underpayments by Medicare to healthcare providers, hospitals, physician practices. For instance, the RAC program is not gone nationwide yet. It started with a demonstration project that ran from 2005 to 2008. 4 contractors will run the RAC in 4 different regions of the country. And we're going to put an image on the screen now that you can see the 4 different regions of the country that each of the contractors will work in. The 4 contractors are Diversified Collection Services of Livermore, California, and they handle Region A. CGI Technologies and Solutions of Fairfax, Virginia, which handles Region B. Connolly Consulting Associates of Wilton, Connecticut, which takes care of Region C, and Health Data Insights of Las Vegas, Nevada, which covers Region D. And these 4 contractors won in what CMS calls a full and open competition, and they make their money on a contingency fee basis on both the overpayments and underpayments they find. So in essence, the contractors are incented. CMS expects that that providers will challenge payments, will challenge the audits, and question whether the RACs have interpreted these so-called underpayments or overpayments correctly. And so there's a process built into RAC whereby providers can challenge the audits.
How successful have the providers' appeals been?
Well, actually, they've been very successful. I think from the demonstration project, the indication is that 97% of appeals have gone in favor of the providers themselves. So when providers do appeal the RAC audits, they generally are successful. So appeal is really a good stance to take if you are providers. It's the incentive, remember, is on the RAC side to do audits, because it's actually less expensive for RACs to do an audit compared to the kind of money they get on the return. I think the data indicates that the RACs only spend 20 cents to collect $1. So it makes a lot of sense financially for the RACs
to be aggressive.
To be aggressive, right? So providers need to be as aggressive as possible in return in appealing.
The purposes of bringing this into the healthcare IT perspective is how information technology can help providers in perhaps preparing for this auditing. Is that something that was discussed at the conference as well?
Yes, and in fact, a lot of the speakers, particularly from the provider side, providers who participated in the demonstration project, said that information technology was essential because one of the things that providers are required to do is provide medical records to the RACs when they question particular claims. And they're required to provide these records within a specific period of time. They have a limited amount of time to respond to the RAC's requests for information. And without records in electronic form, many providers said it was very difficult often to compile these records.
It seems almost like a reverse incentive coming from CMS, you know?
Right.
If you don't have good IT, you're going to be more liable for these audits to hit you harder, you know, or you won't be able to at least challenge them as efficiently.
Right. It is kind of a perverse audit, or a perverse incentive, as you say. Because these audits require you to provide records, it's easier to provide them with electronic records than otherwise. The problem would be for physician practices. and it's also kind of a strange incentive for physician practices, because physician practices can also be audited through the RAC process, and they're also required to implement or to send records. And like hospitals, if they have electronic records, it's much easier to send the records, but of course physician practices don't have the money often to purchase electronic records. But now with the new IT stimulus, perhaps many more will have access to this. So.
Are the RACs going to be wasting their time if they go after small physician practices, or are they going to mostly be focusing on big IDNs and hospitals?
Well, the sense that I got is that they are going to go after physician practices, but they probably will focus on hospitals, because that's where the money is. And one funny quote by one of the speakers in regard to that, he said that for RACs, hospitals will be like the new ATMs, automated teller machines, because he expects RACs to go on fishing expeditions and to find the hospitals that have the most overpayments, and find the hospitals that are not willing to appeal, that are slow to get their records in, and those hospitals will become like cash cows for RACs. I mean, that sounds like a pretty cynical take, but he really believed that RACs, because they're incented by the amount of overpayments that they find, they're paid on that basis, they're going to look for the providers that have the most, and hospitals are likely to be those.